Okay, so this is my AP Psychology project continuation, focused on the treatment for Lucy von Pelt, the character from Peanuts. So, first of all, as a review of the first part of the project, Lucy, I decided, is diagnosed with antisocial personality disorder and borderline personality disorder. So both of these are personality disorders that belong in cluster B. ASPD, the trademark personality traits are kind of aggression and deceitful, and the trademark ones for BPD are they're trying to avoid abandonment and rejection, and they also have frequent mood swings. The main difference between the two is that ASPD is towards others, whereas BPD is towards yourself. So the treatment I decided to recommend is psychotherapy and DBT, or dialectical behavior therapy, kind of as an eclectic approach to solve her problems. So starting off with psychotherapy. So a background, this is recommended to treat both of the disorders together. The beginnings of psychotherapy trace back to Paracelsus something, I don't know how you pronounce that, but he was a citizen of the Roman Empire about 1500, and he was the first advocate for talking about it, like figuring it out that way. Then comes along Walter Cooper Dundy, who was an English psychiatrist, and especially in 1853, where he released a book of some sort that discussed his treatment of psychotherapia. Then Sigmund Freud comes along with psychoanalysis, which is a form of psychotherapy. Carl Rogers comes along with interpersonal therapy, which is yet again a different version of psychotherapy, and his was kind of created in the 1940s, and its main goal is to have a transmission of warmth, genuineness, and acceptance. Economic issues, then, especially in the Americas, the psychotherapy treatment, which used to be years and years, like at least a year at minimum, started to go shorter because people couldn't afford to go for years, and it began to target specific issues rather than their entire life. And then pretty much today, the psychotherapy we use today mostly is a form of cognitive behavioral psychology, which is pretty much from the 1950s on, and it's an emphasis on thoughts and feelings, and it focuses especially on emotional and behavioral problems. You will find other forms of therapies, but this is kind of in terms of the American psychology evolution. This is the one that has happened the most recently. And then down here in the pictures we have Sigmund Freud and Carl Rogers. So the course of psychotherapy, it really is widely varied. Because it depends on the person, it depends which clinic they're going to, like which doctor they're going to, and it depends on what style of therapy the doctor is using. So, like for empirical studies, they are often limited to only 20 sessions, normally like 20 once a week kind of sessions. There are other limits depending on the clinics that you go to. For a chronic personality disorder, it's often 3 years or more. And most psychotherapists agree that if it's long-term, it's better. But the problem that they run into that they want to avoid is they don't want to foster dependency. So they want to keep it long-term, but they don't want to have the dependency. So it falls right where wherever the psychotherapist thinks that is the best place to stop it and to kind of reach a conclusion correctly. And here is the video I chose. Oops. It's not popping up. Okay. Well, then I'll move on, because it pretty much just... Oh, there it goes.
Time to see what light can do. New Neutrogena Light Therapy Acne Mask. With the clinically proven light therapy dermatologists use, it's blue light.
There's a lot that holds us back from trying out psychotherapy. There's the idea that you have to be a little mad or harbour some huge and strange problem to go and see a therapist. It can be hard to see that therapy isn't in fact for the select, disturbed few. It's for everyone, because actually it's entirely ordinary to be rather confused, a bit anxious and sometimes challenged by relationships, family life and the direction of your career. So really, the only qualification for going to therapy is to be a normal human being. There's also the worry about the strangeness of it all. It'll be you and someone you've never met, to whom you're expected to divulge nothing less than your inner life. Why not talk to a friend? Well, firstly because friends aren't properly trained to listen. As one will have noticed, they interrupt a lot. And secondly, because it's sometimes easier to tell someone who has no prior knowledge or expectations of you the big and important things about who you are. Furthermore, therapists are the last people ever to judge. Their concept of a normal human being is far more expansive than that held by society at large. They know how unusual and surprising we are, especially around sex and anxiety. Their whole training takes them into the recesses of their own and others' minds. They know how surprising we can all be. It doesn't frighten them. It intrigues and motivates them. That's why they became therapists in the first place.
So I'm going to stop it there, because it really just continues on in that idea of it's for everyone, and it discusses more of how, like, what it would be like, not so much the background, but, just discusses, because psychotherapy is kind of like the couch therapy. It's kind of the, go sit there, tell everybody your problems, and, work together to fix it kind of thing. Which brings us to the next one, which is the dialectical behavior therapy. And this therapy I chose to go towards to work in unison with the psychotherapy, because they are similar but they have different qualities to them, but using as an eclectic approach to better treat. This was originally aimed more towards BPD, borderline personality disorder, but it really, since a lot of the symptoms are shared between the disorders, they can be used for both. So, background on this, Marsha M. Linehan, who's a psychologist in America, in the late 1980s, she was trained to create a therapy aimed at multi-problematic suicidal women. It ended up being aimed at BPD, or borderline personality disorder, as I said earlier, and it really changed. It went through an evolution to apply to others going on through the process of the therapy. So what is it? It's a cognitive behavioral approach, and it emphasizes psychosocial aspects. So the theory by itself, it just says that some people are prone to react in a more intense and out of ordinary manner towards emotional situations. These same people's arousal levels can increase much quicker than the average person, and which means that they have a higher level of emotional stimulation, and it means that they have to have more time to get back to their baseline levels. And so the emotional stimulation would be like somebody insulted you. And whereas the average person would either get really mad and deal with it or whatever, or get sad for a little bit, but the average person would get over it really quickly, and sometimes would ignore it at all, versus a person with BPD who would go either really angry or really sad really quickly, and then it would take a much longer time to get back to their normal self, kind of thing. And so this therapy is support-oriented and is meant to identify and build strengths. It's cognitive-based because they want to identify the thoughts that make the client's life harder. It's collaborative because they're trying to pay constant attention to relationships, and they want to work out problems in the relationship between the therapist and the client. That way the client sees gets a good example of how he or she are supposed to deal with their relationships and their personal lives. And it also aims at teaching skills. So this would be stuff like homework assignments that would be like role play to teach them new ways of interacting or ways of soothing themselves when they get upset. So the course, so starting down here at the bottom, as you can see, it can last anywhere from 3 months to multiple years. The total length really depends on the client and the therapist. They sit down and discuss, like, okay, well, we want to start, we agreed to go for a 3-month session or a 6-month session or however long, and then after they finish that, they look at the progress that they've made, and then may decide to go back and put forth, like, agree to do another session or something, or to just stop and see how everything goes. So in the sessions, like, what goes into those months and years, so there are individual weekly psychotherapy sessions, and these emphasize problem-solving behavior for the past week's troubles. It's approximately 1 hour, and this is like the psychotherapy section of it, where the client and the therapist sit down and talk about what's happened, and they figure out how to solve it. There's also a weekly group therapy session, which could be anywhere from 1.5 hours to 2.5 hours, and it's led by a trained DBT, dialectical behavior therapist, and that is so that people who are receiving this therapy can work together to solve problems, and they can have a new example and, like, new relationships to try and start and figure out and solve and keep steady, because that is one of the problems that comes along with ASPD or BPD. And then there's also as-needed consultation outside of the regular sessions. So if the client needs it, then the therapist is there for them. And then there's therapist consultation team meetings, which is 1 to 2 hours about once a week, where the therapists that are working on, the variety of clients get together and discuss those clients to make sure that they're working on the same page, and make sure that if there's a problem, then one of the others can help them fix it or whatever. And I'm going to skip the video because it's not terribly long, but it's kind of long. But it's basically Marsha Linehan, and it's her talking about her therapy, and then I think at the end it's actually an example of her doing the therapy, or diagnosing, or helping with, like, the first therapy session, or something like that. So, and I'm excited. Thank you for listening.